keeping an eye on imaging. Discussion and commentary based on articles from JACC, Cardiovascular Imaging.
G'day and welcome to JACC Imaging at CVN. My name's Tom Marwick, one of the associate editors at JACC Imaging. I'm here with Paul Chen from Mid-America Heart Institute at Kansas City. Welcome, Paul. Thank you for joining us.
Thank you.
We're here to discuss a very interesting and I think important paper that links responsiveness at CRT to health quality and symptom status. Paul, can you tell us a little bit about your work?
Sure. Our study involved the Prospect Registry, which was a registry that looked at Dyssynchrony measures across the spectrum of about 12 Dyssynchrony measures by echocardiography among patients with severe heart failure, traditionally NYHA class 3 and 4, who were candidates and recipients of cardiac resynchronization therapy. And the study initially really wanted to examine what the prognostic utility of Dyssynchrony measures were in this population. We were particularly interested in examining the role of these Dyssynchrony measures in prognosticating benefits in health status. Many heart failure patients feel that health status and symptom improvement are as important and sometimes more important than survival benefits from device therapy. And so we felt that looking at these Dyssynchrony measures may gain some insights as to how best to understand the relative benefits and potentially to counsel patients as to how they might benefit from cardiac resynchronization therapy in terms of long-term symptoms. We enrolled about 329 patients who met our criteria with a prolonged QRS duration of 130 milliseconds or greater and who had class 3 and 4 heart failure. And we examined whether or not any of these Dyssynchrony measures were associated with 6-month improvements in health status. We measured health status using the Kansas City Cardiomyopathy Questionnaire, which is a validated and frequently used measure for heart failure health status. And across the 12 measures, we initially found that only 3 of the 12 measures were consistently and able to be measured from the core echo lab to be valuable in the further assessment of prognostication. And these were interventricular mechanical delay, left ventricular filling times less than 40%, as well as left ventricular pre-ejection interval. And when we examined in multivariate models, we found that only interventricular mechanical delay as well as short left ventricular filling times were associated with improvements in 6-month health status of 5 points or greater on the KCCQ. Now, some people have looked at whether or not this is sufficiently enough in a heart failure population that is oftentimes quite symptomatic. And so we looked at a higher response level in health status improvement at 6 months, and specifically a 10-point or greater improvement on the KCCQ. And when we examined with this outcome in mind, we found that interventricular mechanical delay was still a prognostic importance in predicting response for patients. We further examined that among those patients who had 6-month improvements in health status, whether or not that was associated with longer-term survival. And when we stratified patients by quartiles of 6-month improvements on their KCCQ health status, we found that the 6-month additional survival beyond that was the lowest among the patients with the least health status improvement of 81% survival 1 year out, as compared to 95% among the patients in the highest quartile of health status improvement. And again, when we categorize patients as responders of greater than 10-point improvement in KCCQ versus non-responders, we found a significant improvement in survival at 1 year out compared to patients who were classified as non-responders in health status improvement. And so we found a significant relationship between a couple of Dyssynchrony measures. And when we think about how we can use this information in clinical practice, we felt that it would help to inform conversations between clinicians and patients as decisions are made as to whether or not they should undergo cardiac resynchronization therapy and what the expected health status benefits may be given a patient's clinical profile based on some of the characteristics we found in our multivariable model, of which Dyssynchrony was one measure.
So there's so many aspects of this that are interesting. One that I found particularly interesting was the use of the questionnaire. Is that something that we should do more frequently in evaluating these people?
Our institution at the Mid-America Heart Institute has pioneered the use of patient-centered health status questionnaires, either for angina and coronary artery disease, as well as for heart failure, using the KCCQ. And we've looked at the prognostic benefits of health status questionnaires like the KCCQ compared to other health status instruments like the Minnesota Living with Heart Failure instrument, BNP, and other clinical markers. And we have found consistently that the KCCQ outperforms prognostication in terms of readmission, mortality, and more recently in an article in Circulation, resource use when you're out from baseline KCCQ. So we feel that it has good sensitivity and relatively good specificity in identifying patients who are at greater risk of poor outcomes and resource use, who may be candidates for more intensive therapy and follow-up.
Okay, very good. So just to recap, this important paper links markers of mechanical synchrony with symptom improvement and links that to improvements of outcome. It's a paper that I think you'll find interesting. I would commend it to you for your reading. Thank you for joining us on JACC Imaging.